Hello, everyone. We welcome you to this edition of News You Can Use. I'm your host, Thera Martin Milling, and we've just been having a good time today in our studio up here at LaSalle TV, so that's why I'm coming on the show with this big old smile on my face. We are doing good today. On our program today, in our first segment, I am so excited and pleased to tell you that we have the CEO of SpArc Philadelphia. Her name is Laura Princiotta. Yay! And we're so glad that she's going to be here to tell us what she's doing in the heart of North Philadelphia on Westmoreland Avenue. What a special, special situation happens there every day. So we're glad to be able to shine the spotlight on that great story. And then a little bit later on in the show, we turn the page. We got Dr. Donee is here. She's waiting in the wings. She's got a medical student with her who's going to talk some health notes. And we also have Carol Rogers, registered nurse, and a lady that I have known all of my professional career, back when I was 21 years old to this day, and I'm so excited. She's going to come in and talk about affordable health care. You know, the President Obama is trying to hook us up with this health care thing. She will tell us how we can get it all done. So you definitely want to keep your channel right where it is at TV 56 or at Verizon Fios channel 36. Stay with us. We are on our way for a great ride today. We'll be back in just a moment. And we're back again. Here we go with the full show. Miss Laura is here. We're so glad to have her. The CEO, I'm going to say president and CEO, the CEO of SpArc Philadelphia. Thank you for coming.
Oh, it's my pleasure.
Yes, and special props to Jamie, your PR lady, for helping to make this happen. She's awesome.
She is.
Yeah, yeah. Now, for people who are saying, okay, SpArc Philadelphia, what's that? Tell them. What's SpArc?
SpArc Philadelphia is a family of organizations. It includes the ARC of Philadelphia, that is an advocacy organization, and PDDC, that's a service provider. And the mission of the family of organizations is to support people who have disabilities to reach their personal goals. And we do that in a lot of different ways, through including them in their communities and making sure we listen to their choices about what their lives want to be.
Mm-hmm. So people who are handy-capable, is it okay for me to say that?
It's okay to say
are the clientele that you work with.
Yes.
And you've got this huge, I'm going to call it a warehouse. It looks like it was an old warehouse that you all gutted out and made fabulous.
It was actually a cigar factory.
Wow.
Is what it was, on Westmoreland Street.
It's huge. The place is huge.
It's big. And we serve over 400 people there every day, and then another 200 people out in the community. And that's really the critical part of our mission, to connect the people who come to us for programming and for advocacy support to the community. Okay. It's a marginalized population, and they need assistance doing that, so that's what we do.
So when I come over there to go on a tour, because your staff invited me on a tour, Maddie Harrigan and Tim Green said, come on out, come on out. And so I said, okay, I'm gonna take them up and I'm gonna come out and check it out. And from the door, I was amazed. You have this beautiful lobby that has a artwork that I've never seen anything quite like this before. It's tile artwork with wood, and it was just a beautiful, beautiful mural, like a wall mural, but made like none I've ever seen before.
So what we wanted to do was engage our neighbors in a project. And one of the programs that we have is a cultural arts program. And the people who participate in that program thought of the idea for the mural, and they did paintings that informed the final style of the mural. And we invited all of our stakeholders, everybody in the neighborhood, everyone who's connected with the organization to work on it. So it took us 2 years, but every single tile that's up was put up by one of our stakeholders. And what the theme of the mural is speaks to our mission. So there's individuality. There's 4 different seasons, and winter would be the individuality season. And then there's growth, and there's change. So that piece of art, which is pretty fantastic, also is tied into our mission.
Wow. Well, again, it stunned me in a very, very positive way walking in. But then, so they move me along, and I see all kinds of artwork, and I'm like, wow, who did this? Who did this? The clients that we work with, they did this beautiful artwork. I mean, materials and pieces that look like they could be sold for nice sums of money. And then I get to this big, huge room that looked like a football field, and there were long tables, and everybody was busy working. And I was told that some of the residents, or not residents, they don't live there, but some of the clients that you work with, they were actually working on projects for the state of Pennsylvania. The cones that we see on the highway and whatnot, it's your people that make them.
We have contracts with private industry, and the people who participate in that program earn a paycheck every 2 weeks. If you want to have fun, you should come back on a payday.
Wow.
Because it's really exciting, and it doesn't matter how large the paycheck is. It could be $1 million. That's what it feels like, and it's real work. And people learn work skills, and the idea is to have people who have never experienced work before learn in a setting where they have support, and then eventually move out into the community where they can work independently.
Okay. All right. So let's say right now somebody's watching our program, and they're thinking, wow, Johnny's upstairs in his room, and he never gets out, and I don't know how to deal with him anymore. He's 19 years old. He's getting stronger. I can't, deal with him like I used to. Now, I'm not thinking in my head, I'm not visualizing somebody who is handy-capable in a wheelchair. I'm thinking of somebody who can walk and move and stuff, but they're not plugged in anywhere. They're not getting any real services, and mom is so tired. Can that kind of a person pick up a phone and call?
Absolutely.
SpArc?
And that's what the ARC of Philadelphia does. And anyone can call the ARC of Philadelphia, and they can get the supports they need. And depending on, it really depends on the individual and what the family is looking for, and everybody doesn't want a day program. People need direction managing this school district system, or they have no idea of how to get someone connected to any kind of service. And the ARC of Philadelphia can help with that. That's what they do.
What's the earliest age you will take a client into ARC or to SpArc?
The programs at SpArc Philadelphia, we take people 18 years and older. But the ARC of Philadelphia will work with anybody, any age.
What a blessing. What a blessing. Okay. All right, we're running out of time, but real quick, you all do something special the first Friday of every month over there on Westmoreland Avenue. Tell us about that real quick.
We do. We have a First Friday dance, the first Friday of every month, complete with a DJ and a disco ball. And people come from all over the city, and they dance from 6:30 to 9:30.
Anybody can come?
Anybody can come, and everybody does come.
Yeah. And is it like a fundraiser to help SpArc with some of the other initiatives and things that you do?
It's
just
not a fundraiser.
Come out and have a good time, and
that's it.
Yeah, that's great. That is so great. So give us your address and give us your phone number and the website before we say goodbye.
Okay. The phone number is 215-229-4550. The address is 2350 West Westmoreland Street in Philadelphia, and the website is arcpddc.org.
And the website is beautiful and user-friendly. Trust me, I've been there. Thank you so much for coming in. We appreciate you. And again, thanks to Jamie for helping to make this happen, and also the newspaper article that we did in the Allegheny West Neighborhood News. Thank you, thank you, thank you.
Sure.
And I look forward to doing great things with you in the future.
Wonderful. Thank you.
Okay, very good. We will continue with this edition of News You Can Use momentarily. Going to have my longtime friend, registered nurse Carol Rogers will join us to talk about Obama's affordable health care and how we all need to sign up. If you don't have health insurance, you need to sign up before March 31st. We'll be right back.
Sure, that was great.
Diagnosis of breast cancer changes your life forever.
She told me I needed a mastectomy. I was scared, absolutely in shock.
But you need to know that you're not alone. There are teams of medical professionals, support groups, and therapists, and those who can help you plan for life after cancer. Before you undergo surgery for breast cancer, get the facts. Make sure you know your breast reconstruction options. For more information, visit broaddayusa.org.
The environment is my passion. Every day, I live for the outdoors and all of its challenges. That's why I enlisted in the Coast Guard. Now, I serve to protect the environment and defend my country. It's like I was born for this.
Were you born ready for a greater challenge? Find out at GoCoastGuard.com.
We have a job to do out here today.
To be a winning team, you have to work like a winning team.
My team depends on me.
And my team is 50,000 strong. Looks like a lot of work's going into this.
This is what it feels like to be part of a team.
A winning team.
The action team.
Get in on the action at actionteam.org. Are you in?
Training is about more than muscle. It's about inner strength. So I push myself. That's why I serve in the United States Coast Guard. I train with the best. A team that shares my drive and commitment. We collect intelligence, guard our shores against drug smugglers, and keep our waterways safe, because our nation expects more.
If you expect more, maybe you were born ready. Find out at GoCoastGuard.com.
Hello, everyone, and we continue now with this edition of News You Can Use. I'm your host, Thera Martin-Milling. And in this portion of the program, we are so glad again, Dr. Donee from Einstein Medical Center. She put her producing hat back on and did this segment of our show. Ironically, little did she know, little did I know, and little did Carol Rogers know that we'd have this reunion up on this set today. She and I have been together in studios, particularly radio studios, a gazillion times over the years. Met you when I was 21, and I guess you were 21 too, you know? And now all these years later, here we go, reunited again to share health information. And Dr. Donee Paterson, I should add, is the health guru for our show. And she does a regular segment on the show. And so we always appreciate her and what she brings to the table. And I appreciate that she booked you to be here.
Thank you, and it's such a pleasure to see you there, looking
absolutely.
so great after all this time.
Give me that figure, you know? Anyway, doctor, physician's assistant, because I misidentified you when I was doing the teaser coming into this. So you are a physician's assistant, not a registered nurse.
I am not a registered nurse.
But you know your stuff. Know your stuff. And for 30 years, was an employee of this city, the city of Philadelphia, in the health department, helping people and breaking the health information down where everybody can understand it.
Thank you.
Yeah.
And
so,
and I'm thrilled to be able to continue, even though I am retired. I'm running a small organization called Healthy Philadelphia, and we're dedicated to bringing together different elements of the city to work together, dedicated to the idea that everybody in the city deserves decent health care.
Okay, now, the Obama affordable health care piece started like October of 2013, November, but we had some blurps and bumps.
Well, we've been fighting this fight for a long, long time, and it's good that the Affordable Care Act is finally here. Enrollment began, open enrollment during this enrollment period began in October. It was a little bit bumpy, but don't forget that we didn't know until a month before that the Supreme Court was going to find that it was constitutional. So it was very hard getting it started.
The fight. Yeah.
But I'm proud to say that many people in Philadelphia have enrolled, are finding it easy to enroll. Healthy Philadelphia works to get in-person assisters out in community events to assist people in signing up. There are a lot of ways that people can sign up. They can call, they can go online. They can call us at Healthy Philadelphia, and I know the number's going to run a little bit later to tell people where they can go to get in-person assistance.
It's running right now. Okay.
Right. But let me just say that we have some very important deadlines coming up, which is that people who do not have insurance need to enroll need to sign up by March 15th so that they can get coverage as of April 1st. Now, the way the Affordable Care Act has already, and you and I were speaking, we both wish it was universal health care that started at birth and went to death and covered everybody.
Free.
Yes.
F-R-E-E.
Right. But given that this is what we have in the political realities, I am thrilled to be helping people to sign up.
Yes.
So the Affordable Care Act, the way it's supposed to work is that people above 100% of federal poverty level, which for one person is $11,500, for a family of 4 is about $23,500. Those people will get subsidies to help pay for insurance. So those people can go on the website, as I said, they can call. And let me say that when you call the number at the federal government, it's 24/7, and it's also help is available in almost every language that people speak. But the way it was supposed to work was that people above 100% would get subsidies to purchase insurance, and people below 100% would get medical assistance. And when the Supreme Court found that the Affordable Care Act was okay, that the states would have to do it, the one thing that they found that the states didn't have to do was to expand medical assistance. So we're in a state in our state, in the Commonwealth of Pennsylvania, where Governor Corbett has not agreed to accept the federal government's offer to expand medical assistance. So we're in a position where we have people who are poorer than $11,500 a year who aren't going to get any help at all until we work to educate the governor about why it's important to expand medical assistance now, right now. So, you know, our fight is not over.
By a long shot, right? Right.
Well,
now what happens to people who, and I'm not promoting this, but for those folks that, I don't know, their head is down in the mud somewhere, they're not paying attention, they don't know that they have a deadline to apply for this health insurance. I heard something about they can get penalized with their income tax return?
Yes, there is a penalty if you do not have insurance. Now, that's certainly not true for people under 100% of federal poverty level. And it's not true for a number of other people. It's not true for people that make too little, or for people that don't have paperwork to show that they're legally residing here. But for other people, the full penalty, and I think that's really only if you make in the upper amounts of money, the biggest penalty is $95 a year, or 1% of your income. So honestly, if people can afford it, we know that people, I mean, there are many reasons to have health insurance. The penalty is only one of them. The reason to have health insurance is not just so you have an extra card to carry around. It's because when we have health insurance, we are healthier. We are able to access health care on a regular basis with somebody who knows us. We are able to catch problems early so they don't become severe and difficult to treat and devastating illnesses. For example, if you have high blood pressure, much better to see your doctor to find out perhaps how to keep it down without medication. You know, there are many things that you can do, and if you need to get medication, at least your health insurance will pay for that medication. You certainly, you know, we have, not too far from here, we have the highest number of people on dialysis in the world.
Henry Avenue, where the old women's medical used to be?
No, it's actually more surrounded, it's north central Philadelphia. But most of those people, it's because they had high blood pressure that wasn't appropriately treated and managed, and they developed strokes and kidney disease. So there are many reasons to have health insurance besides just the penalty.
Yes, mammograms.
And you know, that's another interesting thing about the Affordable Care Act, because the Affordable Care Act makes preventive health care free. We don't have to pay a copay for it. So many people have noticed, if you go for a mammogram, if you go for a pap test, if you go for a flu shot, anything that's considered preventive, there is no copay for that. And that's really to support the public health.
Okay, wow. Well, we're glad that the Obama Affordable Health Care Plan is now a reality and in process, and people are getting signed up, and I just want to encourage other people to get signed up. I know that State Senator Shirley Kitchen has already hosted several information sessions where experts like you came out, and others who sat with folks and got them signed up on their computers. She's got a couple of more dates coming up in the month of March. I would suggest that people call her office at 215-227-6161. 215-227-6161 to see what her dates are. And she's not the kind of elected official that says, oh, well, if you're not my constituent, I can't help you.
Right.
Anybody can come. And then also the Philadelphia branch of the NAACP. They did an information session last week at Bright Hope Baptist Church in North Philly. They've got another one coming up in the month of March. So folks, you can also call the NAACP office at 215-978-7500. They'll tell you their next date in March when they'll have the affordable health care sign-up thing going on. The NAACP office, one more time, 215-978-7500. 978-7500 for more information about their seminar, workshop, or whatever they want to call it. But affordable health care, that's what it's about, getting people signed up. Yeah. And then the libraries.
Libraries, we have people in the
I just wanted
libraries.
to jump for joy. I read it, I wouldn't have known, except that I read it in the Philadelphia Daily News about librarians, some of them being trained so that they can actually sit with folks who come to the library to get signed up.
Yeah, and we have people in Reading Terminal Market every Friday, except not during the flower show, excuse me. But you know, there's something else I would like to say. In addition to the importance of health insurance, it's not only health insurance, it's also really important to have a place to go for your health care. Philadelphia is rich in having we have fewer and fewer hospitals every year, but we do have a very rich network of federally qualified health centers and federally qualified health center lookalikes. Healthy Philadelphia, we do have a list up on our website. People can certainly call us to find out where they are. So I would urge people, whether they have insurance or not, to please do yourself a favor and find some place that you can go and feel comfortable so that you can get the best gift of all, which is that of good health.
Very, very good information you're sharing. I thank you so much for coming. The phone number again, the website one more time, and I know we do have it up on the screen, but I'd like you to say it as well.
I'm going to have to look for it because I rarely call myself.
That's quite all right. That's quite all right. But for our folks who are blind but who listen to our show.
Oh no, I'm happy to say it. The Healthy Philadelphia phone number is 215-850-2846. We're happy to tell, we know about all those events. We staff many of them, so if people want to know a place to go to get assistance to sign up, to know a health center to go to, and our website is www.healthyphiladelphia.org.
Okay, and I've got one more, and this is props out to Jeff Brown, the owner of like 12 ShopRite supermarkets in Philadelphia. Does he or does he not have sign up going on in his stores?
Yes, he does.
Yes,
he does. Yes.
So
especially at ours in our neighborhood too.
Yes. So we appreciate that. The newest of his stores at Fox and Hunting Park Avenue. So if you're up there, you can ask them the next dates when they're going to have some sign up sessions going on, because there's still a few more to go.
There are a lot. Yeah.
Any final thoughts that you want to give us right quick?
Again, I hope people will not be intimidated by trying to sign up for health insurance. If you do make over that $11,500, or it's more, of course, for a family of 2, 3, or 4, we have been assisting the Taxi Workers Alliance of Philadelphia to sign up, and there are many people that are getting health insurance for 30 cents a month. So please don't be fearful. Just go online, see what you can do. You owe it to yourself to get health insurance.
All right, thank you for sharing that information today, and I can't wait to have you come back again at another time, talk about some of these other health issues. And I'm going to put myself back on the sidebar and let Dr. Donee sit up here and do the interview with you, because I can just see you two medical people together just sharing all that right information. We got to do it that way next time.
Thank you,
Sarah.
Right. Thank you so much.
Appreciate you. And now, speaking of Dr. Donee Paterson, we're going to slip right on over to the segment where she shares her medical information of the day, and she's got Dr. Matt Callaghan with her as well. I think I got the name right. Take it away, Doc.
Drug and alcohol addiction is very common in the U.S., especially in young adolescents. So I'm here with my friend, Dr. Matt Callaghan, and we want to tell you some of the red flags that you may miss if you're not looking for them. So Dr. Matt?
Sure, thank you. So there are two kinds of flags that you should be looking out for in your loved one. One of them being sort of their social interactions with you, and the second being some red flag physical signs in your friend. Some of the social factors when your friend is using drugs or alcohol, they may be more withdrawn, staying in their room more often, or maybe that they're staying in their dorm room and not talking to you as much. Some of the other things that you might notice is, depending on the drug that they're using, they could be more depressed, more even awake at times, having pressured speech, talking more quickly. some of the things you might also notice is maybe they've taken a change in the things that they like to do. Say they used to be very active in the community on the basketball team and love to do sports, and maybe now that they don't find interest in these things anymore. That isn't to say that these things are necessarily because of drugs or alcohol, but it's something that you should be looking out for.
So all of these things are very important, and we want to make sure that you're paying attention. Pay attention to your loved one, because these are things that affect the whole family, not just an individual. So if you have some concerns about your loved one, make sure that you get help from their local physician, or there's definitely resources that you can find online. So as always, I'm Dr. Donee, and I wish you the best of health, but if you can't be the best, you can be better. Thank you.
Thank you, Dr. Donee and Dr. Matt. We appreciate the both of you, and we appreciate all of our viewers out there for checking us out as we did another edition of News You Can Use today. We thank our guests who've been with us today, and certainly Carol, we are so glad to have you. And in our first segment, Ms. Laura, the CEO over there at SpArc, we appreciate her as well. And our last few shows have just been really positive and good, and we want to thank all of our guests who come out. Leslie Nan was here recently talking about the SPCA and how to take care of our pets during cold months and during the heat as well. We had Ms. Rosalie Cooper talking about the RAH Civic Association. A lot of good things happening right here in LaSalle University's TV studio at LaSalle TV 56, also with Verizon Fios Channel 36. And as we wind down on this edition of the show, I just want to remind people that we're in another political season. Here in Pennsylvania, we'll be deciding who's going to be the governor for the next 4 years, who's going to be the lieutenant governor working with that governor, who are our state representatives going to be, and who are our state senators going to be in the even-numbered districts. So, with all of that said, we're in another serious political season, and we certainly would never dare to tell anyone who to vote for, but I certainly would just encourage people to vote, to be involved in the political process. And if you're not a registered voter, it takes about 3 minutes or less to fill out a voter registration form. You can do it online through the Committee of 70, www.committeeof70.org. You can go to any elected official's office and ask them for a blank voter registration form, fill it out, and drop it in the mail before the deadline so that your voice will be counted and your vote will be heard on Election Day, May of 2014. That's when the primary election is. That does it for this edition of News You Can Use. I'm your host, Thera Martin Milling. Check us out next time and have a great day, everyone. Thank you for watching.